Overall dental management considerations for special care clients. Personal and professional prerequisites. Interview the client in a sensitive manner to gather accurate data. Initiate dental hygiene process. Analyze and summarize data in oral or written formats. Use problem-solving skills to develop alternative strategies to manage problems. Evaluate client and professional goals and progress for appropriateness and effectiveness. Remain current on new conditions, new protocols for medical management, and advance in dental and dental hygiene care. Apply new knowledge or techniques from other areas to dental management or special clients. Apply research principles and techniques to acquire clinical data that serve as the basis for care planning and decision making. Office management issues. Stress a team concept with cooperation among members and coordination to information and activities. Dental hygiene procedures may require the help of a dental assistant. Identify and anticipate client needs and problems before initiation of care. Use of a pre-visit questionnaire is helpful. Obtain informed consent for the treatment from the client or an appropriate representative. Explain office policies, procedures, and philosophies to the client and guardian before the very first visit. Determine financial limitations that may affect care planning or payment procedures. Assess additional resources available from other sources. Attempt to provide flexible payment alternatives. If the client is unable to receive care in the office because of physical limitations or geographic distance, determine if care can be provided in the home or community setting with portable equipment. If office facilities do not comply with accessibility guidelines, discuss ways to make them physically accessible, accommodate client needs, or refer the client to a provider who can provide access. Ensure that office layout and environment are not safety hazards or health hazards for some clients. Keep scheduling somewhat flexible to allow the transportation or other problems. Block appointments are helpful when dealing with groups. Be prepared to implement wheelchair transfers. Medical issues. Obtain a health history from the client or caregiver with supplemental information from their other professionals or agency records. Update the health history at each visit. Because many standard health history forms are inadequate for the multiple conditions and problems of some clients, ask supplemental questions. Obtain specific regarding medical treatment, regimens, or other therapies that may affect scheduling or treatment. Obtain names, addresses, and phone numbers for all the client's physicians who might provide helpful data. Be particularly alert to the client's physical status during initial assessment. Monitor vital signs. Record all medication information updated each visit. Note any indication or contraindication to treatment or pre-medication. Maintain records of all medical advice, prescriptions, or drugs given. If clients refuse to disclose medical information or do not follow recommended standard procedures for their own protection, have them sign a statement to that effect for the records. Treatment adaptations. Demonstrate understanding and acceptance of conditions or problems to the client and caregiver or family. Determine which special needs provide adaptations versus client adaptations. Demonstrate empathy, not sympathy. Discuss before implementation. Behavioral expectations. Overview of the entire care plan. Procedures that will be performed at the appointment. Approximate time required. Communication techniques to be used during the appointment. Introduce clients to the oral health care setting gradually by using desensitization, modeling, show, tell, do, or other methods. Ensure client comfort in the dental chair through frequent assurance, positioning, and supportive measures as needed, such as pillows. Explain carefully any need for the client body restraints or stabilization for behavioral or stability purposes to ensure the clinician's safety and the client's safety while in the chair. Velcro straps, similar to safety belts, are helpful for stability. Ensure the following. Obtain the informed consent to use these aids. Ensure least restrictive restraint is used. Clearly document restraint used. Check state regulations to ensure proper compliance.